witness the person slump, what should you do? Again, we are looking at SafERR action at emergency. What should be your response? There is an acronym that guides us in what to do when we find ourselves in situations like this. Don't forget, people slump any day, anywhere, anytime. It could just be a traffic warden. After walking for several hours, he slumps, she slumps. What would you do as a bystander, as a witness? You could be in the house, anybody can slump. Grandpa can slump, God forbid. Somebody say God forbid. Grandma can slump, somebody say God forbid. But even if God will forbid, sometimes we find ourselves in situations like this. The question is, do you know what to do? There's an acronym that we use to determine what we should do when we find ourselves in situations like this. We call it Dr. ABC. Can we say Dr. ABC? Dr. ABC. Now, we take the abbreviation of doctor, which is DRO. Somebody say DRO. Then we add ABC to it. So what we have is DRO ABC. Can we say that? DRO ABC. Let's say it again. DRO ABC. Somebody say danger. Danger. Somebody say danger. Danger. So we are checking for danger. What it means is that we need to check around to see if there's anything posing danger to the casualty or even to you that wants to help. Now let us picture a situation where it is a traffic warden who slumps in the middle of the road. Would you just rush to help? Talk to me. Would you just rush to help? No. Because the area is dangerous. Any motor, any careless driver can run into you. So you need to be sure that the environment is safe for you to want to help in the first place. And call, if you know his or her name, just start, call the name. Mary, John, can you hear me? You are checking for response. You are checking if the casualty will respond. If the casualty raises the hand or the leg, it means there's a response. What that means is that the situation is not so deadly. It could just be simple fainting. Are we together? Hello? When there is response, it means most likely it is fainting, which is not so serious. But we are not going to stop there. We are still going to check for something else. What's our next letter? A. We are going to open airway. Check the airway just to be sure that it is open. Hello? Airway. Check the airway just to be sure that it's open. Sometimes somebody slumps and the position is such that the person cannot breathe properly. Are we together? Yes. Can we do this? Just bring your head so close to your chest, allowing your jaw to touch your chest in a way. Is breathing easy? What's our next letter? B. Check for breathing. Check for breathing. How do you check for breathing? You kneel close to the casualty, take your cheek close to the casualty, listen and feel. You look at the rise and fall of the chest. Normally when you breathe, the chest rises and falls. True or false? And you also feel for breath if the casualty is breathing. Again, if the casualty is breathing, it means it's just a fainting. It's a brief loss of unconsciousness. And that's what we call fainting. But if you cannot feel for air, if you cannot see the rise and fall of the chest, it means that there is no breathing. Are we together? That makes it a little bit more difficult. A difficult situation to handle. What's our next letter? C. C. C is circulation. Somebody says circulation. Circulation. Good. I think one of the students had asked a question a while ago, talked about pulse. It is at this point you check the pulse of the casualty. Now, how do you check the pulse? I want you to raise your right hand like this. Can everybody do this? Good, fine. Now, on this spot, there are many pulse points in your body, pressure points. But the easiest one is right around this area. So you are going to use, don't use your thumb, please. Use your index finger to look for it. you will find, if you find your pulse, let me know. Raise your hand. You will find, it's like, you know what is pulse? You feel the pulse. Have you found it? Yes. Good. Some of you may not be able to find your one. Should I give you touch or something to find it? So that's where you find it. Then, again, there's another one here that you could use. Are we together? You just put your 2 fingers here and you feel the pulse. So if you feel the pulse, it means there's circulation. C stands for what? Circulation. It means there's circulation of blood. But if you cannot find pulse, it means that there is no circulation of blood. What all of this translates to is the simple fact that the heart has stopped. Say compression. Compression. Somebody say compression. Compression. In compressing the chest, we are squashing the heart. Don't forget, for the heart to perform its function, which is the circulation of oxygenated blood, it has to keep pumping. I hope you understand that. It has to keep pumping. And don't forget, all the organs and all the tissues in the body, they all need oxygenated blood. But now that the heart has stopped pumping blood, we have to restart it. So in compressing the chest, for each compression, we squash the heart. For each compression, we squash the heart. And as we squash the heart, blood will naturally flow to all organs and tissues in the body. Are we together? Especially the brain, which will eventually begin to die after a cardiac arrest within 4 to 6 minutes. Did you get that? Yes. If somebody has a cardiac arrest, within 4 to 6 minutes, the brain will begin to die. And in 10 minutes, there's practically nothing you can do about the situation. And that's why you hear of cases where somebody has a cardiac arrest, everybody's shouting, nobody knows what to do. They rush the person to the hospital. Thanks to our bad road, before you get to the hospital, maybe 15, 20 minutes, the doctor checks and place the heel of this hand on the center of the chest. Are we together? On the center of the chest, and this is the way you are going to do the compression. How many chest compression? 30. Somebody say 30. 30. Now, after 30 chest compression, you are going to open airway. Somebody say open airway. Open airway. Head, teeth, chin lift. You open the airway just to be sure that air goes in. Then you are going to administer what we call rescue breath. At this point, if you have something to serve as a barrier, you could just get the cellophane, cut a small part of it and put on the face. The small hole in the cellophane, that's from where you administer the air. You pinch the nose, put your mouth on the casualty's mouth, and breathe in. You release your nose, you look, listen, and feel just to be sure that the air goes in. You administer another one. You look, listen, and feel just to be sure. That's 2 rescue breaths. Then you go back to chest compression. So CPR simply means 30 chest compression, then 2 rescue breaths. Can we say that? 30 chest compression and 2 rescue breaths. Again. 30 chest compression and 2 rescue breaths. But don't forget, before you administer the rescue breath, just ensure that the airway is open. And how do you do that? Head, teeth, chin lift. You see the way I'm raising the casualty's face? Just to be sure that air goes in. Are we together? There are 4 or 5 instances where you stop. The first one is when you succeed. When you suddenly realize that the casualty is responding. Are we together? When the casualty responds, it means that you stop. Then when the area becomes unsafe, you also stop. There's something we call compression only CPR. If you do your chest compression properly, you will still get the result even when you don't do the rescue breath. Are we together? When you do your chest compression properly, you can still get the result. Keep doing CPR even as we take the casualty to the hospital, to preserve the casualty's life, because time is of essence. I just told you, within 4 to 6 minutes, the brain begins to die. and in 10 minutes there's practically nothing you can do.